Hi, I'm Dr. Leslie Wakefield. I'm a pelvic health physical therapist here at Wellsprings, and I wanted to take a minute to talk about men's pelvic health because we've just brought on a new therapist who I'm really excited about. And I think I think there's a lack of awareness around the specific needs that men may have in terms of their pelvic health. And this is actually one of the few areas in medicine, ironically, that men are underserved. We usually think of women being an underserved group within medicine, and in this case, men take the cake. I believe that they have a harder time, one, seeking care, two, being able to find the person who can treat them. I think there's a lot of stigma around a man asking for help in that way. And I think that a lot of men sort of program themselves to just deal with it. You know, they have this pain, they have this dysfunction, but they're embarrassed to talk about it. They wouldn't even know who to talk to about it, and they certainly wouldn't know where to get help. So I wanted to take a minute to talk about that. What are some of the reasons that a man might want to seek out pelvic health physical therapy? And it's pretty similar to the reasons that a woman might. Obviously, sans pregnancy postpartum, but we've got issues of urination, we've got issues of defecation, and we've certainly got pelvic pain and sexual function. So for bladder issues, there are certainly bladder pain syndromes, there are certainly issues around urgency and frequency, and men can also get UTIs. They can require catheterization. There could be issues after surgery, for example, a prostate surgery, where a man needs to relearn continence. And that can be intimidating and that can be potentially embarrassing, but it shouldn't be. It absolutely shouldn't be. So that's one. There's defecation issues, which could include constipation or smearing or incontinence. So there's a lot we can do with helping both men and women to be able to pass stool without pain, without straining, without exacerbating a prolapse or giving themselves hemorrhoids or fissures. We can do a lot of work to assist with constipation. And on the other side, we work with fecal smearing or fecal incontinence all the time. It's a lot more common than people realize. And we can treat that again in both women and men. For sexual function, there's an array of issues that pelvic health can help with. We can help with pain. We can help with premature ejaculation. We can help with erectile dysfunction. And we have a pelvic health specialist, a male pelvic health specialist on staff who specializes in these things specifically. So as embarrassing as a man might feel to go talk to a woman about some of these things, depending on the man, some men don't care. I don't want to overgeneralize, but I think there's a lot of value in having a male pelvic health therapist that they can come speak with and maybe have someone who understands where they're coming from a little bit better. There is value in the empathy component, true empathy that a man can have with another man for this. And lastly, we have pain. Men can also have pelvic pain conditions. In the past, the urologists just sort of labeled everything prostatitis because they didn't know what else it could be. But we now know that men have pelvic floor dysfunction and pain generated by the pelvic floor, by the pudendal nerve, by the tailbone, by the visceral structures in that area. Men can have pelvic pain just like women can. So between issues of urination, defecation, meaning pooping, sexual function, pelvic pain, post-surgical issues. There's so many ways that we can help our male patients achieve a more optimal quality of life, to be comfortable, to be confident. And I think men think that they're alone in these things. They really aren't. I think men wouldn't know where to look, but we are here, and we're trying to do a better job of educating some of these needs that have been overlooked in time. So if you or someone you know and love might be having some of these issues, I highly encourage you to give us a call. We can just talk on the phone about it. You don't necessarily have to come in. It's better to get comfortable and know who you're working with and know if we can even help. But we'd be happy to speak with you on the phone and get you set up, and hopefully we will see you soon.